Good morning. I'm Nicole Dupuy, the Chief Executive Officer for the Windsor-Essex County Health Unit, and thank you for joining us. In Windsor-Essex, we currently have had a total of 19,025 cases to date of COVID-19. Over the weekend, since September 17th, that was an increase of 173 new cases in Windsor-Essex. We had 47 cases reported on September 11th, Saturday. 78 cases were reported on Sunday, September 12th, and we're reporting an additional 48 cases for the September 13th. Overall, amongst the 173 cases, 64 are close contacts of a confirmed case, 37 are community acquired, 3 are outbreak related, 3 cases were travel related, and 66 of our cases are still under investigation. We have 515 active cases of COVID-19 and 312 variant of concern cases are currently active. Currently, we have 20 cases that are hospitalized and 4 cases in the ICU, and there are 20 active outbreaks across Windsor-Essex, 17 in workplaces, 2 in the community, and 1 in long-term care. Windsor-Essex has come together to tackle many challenges during the COVID-19 pandemic. We have helped those hit by the pandemic. We've followed public health guidelines, and most of us are vaccinated, currently about 65% of overall and 75% 12 plus. Unfortunately, we are still behind the provincial average when we compare single dose and completed vaccinations, and we are behind the requirements necessary for community immunity. We're trying to reach 90% in our community. We see in our daily numbers that our cases continue to rise due to the spread of the Delta variant, as do hospitalizations and death due to COVID. The good news is that we can all do something about this. Fully vaccinated people are much less likely to get the virus, and is less likely for them to get sick or to have severe consequences from the virus. Importantly, fully vaccinated people are also less likely to spread the disease to others, however they can still do so. We've accomplished so much together so far, and I know we can improve our vaccination rates to protect people we see and live with every day. We're at a critical point, and it's very important that we continue to increase our vaccination rates. If you're not vaccinated or are partially vaccinated, get in for a vaccination appointment as soon as possible. You can visit a pharmacy, your local healthcare provider, or our mass vaccination site at Devonshire Mall, which is still taking walk-ins. If you know someone that needs help to get a vaccination appointment, help them to make arrangements, or you can give us a call and we'll help make that appointment. If you know someone with questions about vaccinations, speak calmly and kindly with them to answer their questions. Make sure you're informed with the facts. And if you have questions, reach out to healthcare provider or call us at the health unit. We've accomplished so much together, and I know we can continue to improve our rates to ensure that we can continue to move safely as a community. There's also a few other reasons to get vaccinated. Next week, the province will launch their vaccination verification process, which will be required for certain settings. As well, if you are fully vaccinated, you can enter in the city and the county's We Vax to Win campaign. That's WEVAXTOWIN.ca, where they will start drawing prizes for those that are fully vaccinated and registered in the campaign for up more than $200,000 worth of prizes. So there's lots of incentives to get vaccinated, and in particular, certainly the health of yourself, your family, and your community. So don't wait, and get out and get your first or second dose immediately. I'll now turn it over to Dr. Shankar Nezathuri, our Acting Medical Officer of Health. Thank you.
So, Nicole, thank you for allowing me to speak today. Colleagues in the media, I appreciate the opportunity to have this dialogue. So today's my first day serving in this capacity, and I look forward to working with you as we continue our messaging related to COVID-19. I just have a few comments, and they supplement and highlight the key points that Nicole had made, our CEO. My first point is that COVID has affected every member of our community. It's affected every individual, it's affected every family member, it's affected every school, every university, college, workplace, places of worship. And we are seeing an increase in the number of COVID cases, and it's an important juncture for our community related to COVID. Secondly, vaccination is one of the many measures that we're trying to implement as a society to try to control COVID. And I want to spend a little time talking about vaccination. So when a person gets vaccinated, they help themselves, because if they're vaccinated, they're less likely to contract COVID. And if they do, they're likely to have a more mild form of the disease, and they're a lot less likely to be admitted to the hospital and suffer the adverse consequences. So although vaccination doesn't completely prevent you from getting the illness, it does mitigate the consequences of getting COVID. Secondly, vaccination is likely to decrease the chances of contracting COVID and transmitting it to somebody else. And that's an important thing. We want to try to prevent the spread of COVID throughout the community. So the core message that I have today is there are tens of thousands of people in the health district who are not vaccinated, who are eligible for the vaccine. And I appeal to those people who are currently not vaccinated and eligible to go get vaccinated. For some people, it's a matter of convenience, and the health district and community partners have tried to make it as convenient as possible to get vaccinated. For some people, there's reticence. And my feeling about this is sometimes as parents, as children, we're all part of, as spouses, we have to do things that we may initially have some reservation about will benefit the people that we love. So if you're not vaccinated currently, if you can't get vaccinated because you have some personal reticence about it, well, think about how you can help the people that you might love, your children, your parents, because vaccination helps not only you, but it also helps the broader community, and that's something we need right now. As we get a higher level of vaccination, we'll be able to perhaps pull back on other public health measures. And that's another benefit of trying to get the broadest number of people vaccinated at the current time. So thank you for allowing me to speak on this point, and Nicole and I are happy to answer any questions.
We'll now take questions from the media. Today we'll start with CTV.
Yes, good morning and welcome. Just wondering, what are your top priorities? I mean, obviously you talked about vaccine, but as the interim medical officer of health, what are your top priorities for the region?
Well, there are, and not to be exhaustive about this, but as a preliminary thought, the first thing is that to try to contribute to reducing the burden of COVID-19 on the community. And as an immediate step is to try to, the health district overall, the public health service, the community overall, to try to get vaccination rates to a higher level. But then there's this other goal that we have to think about. One is that there are other priorities in health as well that have been put to the side or put lower on the priority list because of COVID, and we have to continue to work on addressing those items as well. The number of deaths associated with opioids, improving services and care to newborns and their mothers, working on other environmental health issues. So I think the immediate challenge is working on COVID and trying to diminish its burden to the community. But I think that the longer-term challenge is to at least try as best as we can to also work on other public health priorities, which are also important to the community.
Thank you. And are there any plans for third doses locally?
Yeah, Nicole can comment on the operationalization of that. Nicole, can I ask you to comment on that kindly?
Yeah, absolutely. So I believe we've answered this before. Currently, we're following the direction of the Ministry of Health, and we are delivering third doses to that identified groups in the Ministry of Health, so specific individuals that are immunocompromised, as well as our long-term care. So that plan and rollout is happening now related to third doses. We don't have any further information on additional groups that will be included as part of a third dose of COVID, or what's being called as a booster. So at this time, we are operationalizing the ministry direction, working with our hospital partners and community partners, and there are no additional groups planned at this time, or we have not received direction for any additional groups.
Okay. And do you have an update on the out-of-province vaccine surveys?
Yeah. So we actually recently launched a campaign. So we're not sure if some of the uptake, we have seen a big increase. I think we've received at least 1,000 over the past week or so. We launched a campaign with some of our employers who in the US employ Canadians to try to have them encourage employees to register their vaccination with us. As well, it happened to coincide with the timing of the announcement from the province of the vaccination verification process for certain settings. So we think it's a bit of a combination of both, but we have seen a big jump in the number of folks who have submitted their registration requests with us, and we just ask them to be patient. It is quite a bit of work, and in some cases we need to connect and verify. So we are, everyone who submits will get a response that lets them know that we've received their submission, and then we'll have to go through and verify them. And so it may take us a week or two before they actually get in the system, but we did receive quite a number of additional registrations, which is great.
Okay, thank you. And now that school is back in session, what are your thoughts on requiring education staff to be vaccinated and not just recommended in testing?
So I'll turn it over to Dr. Yeah, thanks, Dr. Necessary.
Well, the more people that are vaccinated, that is one part of the group of interventions, the suite of measures that can control COVID-19. Education policy is set by the Ministry of Education, and I think that you may want to ask the Ministry of Education officials to comment on that. But as a generic construct, we want, at the Public Health Service, we want to encourage people to get vaccinated, and vaccination is likely to, it will contribute to decreasing the burden of COVID-19 on the community.
I'll just add to what Dr. Necessary said, that our health unit has put out messaging in relation to encouraging all employers to put in a policy or process for ensuring vaccination or encouraging vaccination among their employees. So, that recommendation still stands and is not exclusive to any one group. It's really an encouragement for all employers to consider a vaccination policy.
Thank you.
Any questions from CBC?
Yes, good morning. My question is for Dr. Necessary. Welcome. My question is, hundreds of students were dismissed due to possible COVID-19 exposure during the first week of school. I'm wondering, how much does the situation have to escalate for shutting down in-person learning to be on the table? And is this something that is being actively considered right now?
Well, I think that all the different options always remain available as we move through the pandemic. I'm hopeful that we can continue to keep the schools open. In fact, from my perspective, one of the most important public health goals is to try to keep the instructional component of school opening, meaning that it's particularly important as a public health priority to allow young people to go to school and get instruction, getting instruction from their teachers. And that would be, from my perspective, an important public health goal. We already have experience from having to discontinue in-person learning in previous parts of the pandemic, and But it's very hard to predict the future, and it's the one thing we know about the pandemic is we don't really know what the future might hold. But if case counts don't get under control and the disease is not controlled well, then that may be one further group of measures that could be considered moving forward.
Thank you. And switching gears entirely, in relation to reopening city pools, I've heard that there's been a directive from WECHU prohibiting in-water rescue training required for recertifying lifeguards. I'm wondering if you can elaborate a bit on this and maybe explain why this in-water rescue training is being prohibited and what it means for the reopening of the city's pools.
So just comment if I'm just.
Yeah.
Go ahead. I'll turn it back to Dr. Necessary. Go ahead.
Now, Nicole, if you could comment on that, because I want to be respectful of what the policies have been about talking about individual cases of the health district. So maybe if you could comment on that, and I can supplement as appropriate.
So if I could just clarify, I want to make sure, if you could just repeat your question, it would be appreciated. I want to make sure I answer it properly.
I'm sorry?
Could you just repeat your question?
Oh, sorry. Yes, I've heard that WECHU is prohibiting in-water rescue training, and that's required for recertifying the lifeguards at city pools. And I was just wondering if you could explain the policy, and I guess if you know what it means for the reopening of pools, that would be great if you could comment on that as well. So
I'll speak to relative to reopening of pools. It's not a condition related to reopening, closing, or reopening a pool. We have provided some advice in one instance. In any case, we're always going to review and provide guidance as it relates to a safety plan for activities. And there are some additional measures that we feel need to be put in place and considered as it relates to rescue training and in-water rescue training to minimize the risk of exposure to COVID-19. And so I'll leave it at that. It's not a broad policy or a broad statement around rescue training. In one particular instance, we've requested just some additional components to be put in place to ensure that it's operated in a way that minimizes as much as possible any risk of COVID-19 should there be any exposure.
Thank you.
And if I could just add, there are many activities that people engage in that are relatively high risk for COVID-19. And those are activities where people are in close proximity to each other and not able to wear a mask on top of that. So we always look at activities that are at relatively higher risk and see if they can be done in other ways or if they need to be continued at all. And so that's the balancing act of the Public Health Service. But it's also the judgment calls that every institution, school, instructional organization has to deal with, which is, are the activities that they're currently doing for instruction worth the risk-benefit of exposure of COVID-19? And will that, are there alternate ways of providing that educational experience in the context of the pandemic?
Thank you.
Any questions from Blackburn?
Yes, good morning. Melanie touched on most of my questions. I was going to ask about third doses. I know you said you haven't had any direction from the province, but have you had any indication that seniors in the community are in need of that booster? Is that something that you are requesting or in talks with the province? Have you been noticing any, hospitalizations or things of that nature of seniors who have already been fully vaccinated?
Nicole, perhaps you can comment on that.
Yeah, at this time, we haven't provided any advice relative to any other group to receive a third dose. Again, we always follow the recommendations and advice and guidance of the Ministry of Health as it relates to the vaccine rollout and implementation in those groups that are prioritized. So, excuse me. at this point in time, again, we haven't heard about any additional groups being added beyond those that the evidence supports. Evidence is being reviewed all the time. So we really look to the, ministry, the science tables, and those that are reviewing this type of information to provide us with direction. But we haven't provided any advice.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Nicole. Good morning, Dr. Nazaturi, and welcome. On the topic of schools, I'm reading the COVID-19 exposure notification and instructions that are being sent home to parents. The instructions specifically say that if a variant of concern has been identified, your child must self-isolate whether or not they're fully vaccinated. And this is sort of contrary to what the province has been saying, even what you've been saying, Nicole, in terms of urging parents to get their children fully vaccinated and that they might not have to self-isolate. So are fully vaccinated students being required to self-isolate following an exposure, considering that every case now is pretty much the Delta variant?
So I just want to clarify, we have always said that they may not have to self-isolate. So it's one benefit, potentially. The main benefits of vaccination, certainly, that should be underscored and not minimized in any way, is that it reduces the likelihood that you will contract COVID-19 if exposed. And also, if you're vaccinated, those who are vaccinated, we know have much less severe outcomes. In many cases, they're, have very mild symptoms or completely asymptomatic, and certainly are less likely to be hospitalized and die due to COVID-19, which is particularly important, especially in facing, Delta variant, which we know, spreads quicker, et cetera. So we've, I've always said they may not be required to self-isolate. When we are aware of a VOC, we do assess the risk, and in those cases, students, regardless of vaccination status, will be asked to isolate because it's information we have at that time around the increased risk of spread, and so that is our current direction. But it doesn't minimize the need or the importance of vaccination by any means.
Thank you.
Any additional questions from CTV?
Yes, good morning. Just one. What are your thoughts on the protests outside of the hospitals in some of the other regions?
I think we have, commented before. I certainly, Dr. Ahmed, I know, has commented a number of times on, protests. It is, people have certainly a right to speak how they feel. It's disheartening for us in public health, to see resistance relative to, keeping the community safe and doing, what's in the best interest of the community and community health. I don't know that I have much more to comment on that other than, it's, can be disheartening certainly for staff that are working hard, but yeah, I'll just leave it at that.
Yeah, if I could just,
Yeah.
if I could just supplement Nicole's answer. At the Public Health Service, we always welcome dialogue, and people have, in a free society, people are able to articulate their disagreements and protest peacefully, and that's something we accept. And secondly, during the pandemic, we're learning more and more about the pandemic as time progresses. It's a new disease. But I also think that this is the most important message, which is that we need the community to participate and embrace the public health measures, including vaccination, if we're going to try to get a better control of COVID-19. If we can get the burden of illness to be diminished, then we may be able to scale back on some of the public health measures that we currently have in place. So to the extent that people have a right to protest and articulate their disagreements, we accept that at the Public Health Service. We accept that people have disagreements with public policy and public health policy. But we also ask the community that to support us in the public health mission, the people who work in the public health service and other health services are working diligently to try to bring COVID-19 under control, but also to provide other health services to people which have been interrupted or delayed or disrupted because of the pandemic.
Thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from the Windsor Star?
Yes, just one more. It's likely for Nicole. 16 cases in schools over the last week or less. How are public health resources holding up?
Yeah, thanks for that question, Taylor. I have a meeting actually this morning to talk a little bit about resources and, how we can organize ourselves to stay on top of everything. Certainly, when we have exposures in the schools, we have dismissals. It is a lot of work for us. We are also added to this year, we'll assess vaccination status, in particular in older children, in order to, because the advice is different. And so, we'll just be regrouping this morning internally to look at how we can organize our staff. If we know we're continuing to onboard additional staff. So it's quite a burden for us. I guess I'll reinforce some of our recommendations around, again, I know I said it last week, around the extracurriculars. Right now, we're just dealing with instructional time, which is a little bit less complex. The number of, spaces that children are in is limited to their classroom, which makes it a little bit easier. But it is quite a bit. We have a number of exposures and a lot of dismissals, and it does increase the work. So we'll be monitoring it and addressing and making changes to our practice as we move forward.
Is each school assigned a... Sorry, go ahead, Doctor.
So if I could just supplement Nicole's comment and just echo this. Every single case requires contact management, which means we have to contact the people who are potentially exposed and give them guidance and instruction. It can be, every case can be hours of time of the public health service. Now, when the case counts are low or unmanaged at a level that we can manage, we can meet that mission. When the case counts get to a point where we can't meet the mission, then we're challenged. And from a community point of view, the most important reason we have case and contact management, the contacting people who are infected with COVID and trying to identify their close contact, is to contain the disease so it doesn't spread, try to minimize the spread throughout the broader community. So that is one of the challenges we face, is that if we cannot seem to get better control, that we may ultimately saturate all of our public health resources and not meet our mission in the way that we would like.
Thank you for that, Doctor. And Nicole, I just want to go back. Is each school assigned a public health nurse again, like when in-person learning was active previously?
So we use a little bit of a different model. All schools do have access to a school nurse. Just in relation to resources, we use a health equity or a model where schools that are deemed from a social determinants of health or health equity lens to be, so their health outcomes are more at risk. They have a dedicated school nurse and more time, and then we have a pool of school nurses that will respond to other schools that we deem as sort of moderate or medium risk. But yeah, every school does have access to our school hotline, our intake and triage, as well as our school nurses, whether it's an individual nurse that's assigned and they're named and they know them well, or if it's a pool of nurses that respond to their needs. So that continues, and they're a very busy team.
Thank you for that. And sorry, just one more question, just because I just saw the email from the health unit, today's numbers update. Do you have the ages of the individuals who've passed away, the 2 deaths that were reported? They're just not included in today's written update.
I do not, but we can get that information to the media.
Thank you very much.
Thank you, everyone. Have a good day.